Speaking about public affairs, it's probably seemed to many that we've taken a bit of a hiatus over the last couple of years, but that's been pretty far from the truth. We realized pretty early on in the COVID pandemic that has ruled or ruined our lives over the last couple of years, that there was a lot of disinformation, a lot of confusion, a lack of leadership at both the provincial and federal levels. And as practicing physicians, we kind of realized that if we weren't understanding this, how were our members to, sort of separate the wheat from the chaff? So in order to be nimble, we decided to forego the usual process in public affairs, and we actually formed a little bit of a kitchen cabinet of 4 or 5 members that included both public affairs members as well as board people, so that we could respond in a timely manner to try and bring some kind of comprehensiveness or cohesion to the messaging in and around COVID. And so I don't know how many things were put out on the website, but it was a fair number, and it was hard work, I think, between the 5 of us to get this done, but I hope that the membership at least approved our efforts. We also were asked by the federal government to present on 2 sessions with respect to our feelings about the federal COVID response, and I can tell you that they heard the truth from us, and it wasn't necessarily always that pleasant. Going forward with respect to COVID, there will be a forensic autopsy of what went wrong during our nation's response to this pandemic, and I'm determined to make sure that we are well prepared to address those concerns at the federal and provincial levels when those things come. So part of our activities of the coming year will be, as with the Romano report, preparing ourselves to have position statements for each and every one of the areas of concern. Despite the focus on COVID, there were other things that happened. I am very proud of our position paper on violence in the emergency department. I think that's an important step. The next step to that, however, will be sort of putting some of the recommendations into action so that we can all be guaranteed with a safe workplace for both ourselves, our colleagues, and our patients. There will be some other things that we'll be looking at this year. Yes, Cape Board has some things for us to do, but we also want to look at the concept of universal screening for intimate partner violence in the emergency department. That's something I feel very strongly about, and I think that we need to go forward with that. Lastly, the Cape Public Affairs started back in year 2000 with me, actually, and I've had the pleasure of working with Andy Affleck and now Atul Kapoor. I mean, Andy Affleck and I were the odd couple, but me and Atul are definitely the odd couple. But our committee has grown from just a couple of people to dozens of people. And they are bright, and they are motivated, and they are articulate, and they are passionate, and I feel the future's in good hands. I just attended a session on advocacy here. It was decidedly a masterclass on how to advocate in a healthcare setting. And so, when I look at that, and when I look at advocates in our community that don't go recognized at awards ceremonies and at annual meetings, people like Eddie Lang, people like Trevor Jane, who walk the walk in terms of that core competency of advocacy, I really feel we're in really good hands for the future. Thank you very much.